Nigeria is known for high prevalence of malaria, and it is a leading cause of morbidity and mortality in the country. Available records show that at least 50% of the population of Nigeria suffers from at least one episode of malaria each year, and malaria accounts for over 60% of all outpatient attendance, 30% of all hospital admissions, and is responsible for almost 500,000 deaths annually. Little wonder that Nigeria's malaria control program is the largest in the world.
Our malaria program is the largest in the world today. We believe that by the end of 2010, we would actually reduce mortality and morbidity from malaria by about 50%. So those are things that, I think will make a lot of difference to this. And I believe that if we pursue those programs aggressively as we're doing, we will be able to get there.
And the figures are already changing. The number of reported cases of malaria is reducing. For instance, the prevalence rate of malaria declined from over 2,000 per 100,000 9 years ago to about 1,000 per 100,000 in 2004. The Rollback Malaria Initiative, set in motion after the famous Abuja Declaration on Rollback Malaria in Africa by African heads of state and government in the year 2000, has contributed to the fight against malaria in Nigeria.
Prevalence rates of malaria is now down when compared to how it was maybe if you look at 2005. We're making progress in that, because this may not be unconnected with the fact that in the last few years, using the Dev Relief Gains funding, we've supported a number of initiatives to support the National Malaria Control Program.
The Federal Ministry of Health has got a rollback malaria program. There's a national policy on it, and so what we've done is to support the treatment side of that and the provision of ACTs and bed nets. Of course, we've also done that too with the states in the conditional grants program. So inputs into the malaria program we have been supporting for the last 4 years. However, what is clearly needed now are the challenges that we face with ensuring that this happens within the primary healthcare system at the local level, and that we're getting both the federal and the state level interventions with the international support harmonized better.
If you look at awareness, service provision or service access, in the urban areas we're doing fairly well, but vast majorities of rural areas do not have access to HIV services, TB services, and malaria, and attempts are now being made to address those issues. So I am confident that, even though we have these challenges, that we will address them in a very short time.
Nigeria is indeed winning the fight against malaria, but there are other diseases ravaging the poor across the country. Tuberculosis is one of them. Nigeria has the highest prevalence rate in Africa. Significant progress has also been made in providing treatment. With the help of international development partners and debt relief gains, more direct observed treatment short courses or DOTS services have been provided and are set to cover all the 36 states in Nigeria and the Federal Capital Territory.